Hello, good morning. My name is Dr. Tracy McClellan, and welcome to our Nurse Assistant Training Program. Today, we're going to cover Chapter 1. You should have in front of you your Nurse Assistant book, and that's what we're going to use to do an overview of the material for Chapter 1. Okay, let's get started. Chapter 1, this chapter lays the foundation for everything you'll do as a nurse assistant. You're stepping into a career that's built on compassion, respect, and professional care. So let's look at what it really means to be a part of the healthcare team. The first thing we want to look at with section 1 in your book is understanding the healthcare setting. And let's look at it together. If you'll just scroll through chapter 1, looking at some of the headings, the titles, you'll see some of the things that we're going to be discussing in chapter 1. Okay, so in section 1, understanding the healthcare setting, healthcare is delivered in many settings: hospitals, clinics, long-term care facilities, assisted living centers, home health environments. Today, CNAs often work in long-term care facilities, which is sometimes called nursing homes. Make sure you are aware of that. There are different names for different types of facilities, or they may be called skilled nursing facilities. Your role there is essential. Please know that. You are always vital in those environments. You'll provide daily hands-on care, serve as the eyes and ears for the nursing team. And even while I'm talking, you can be, glancing down the chapter in your book, chapter 1, to find information regarding what I'm discussing here. You don't have to just be looking at the screen. Remember, everyone in healthcare is connected by what we call the chain of command. That's a key word you need to be familiar with: chain of command. That chain exists to protect the resident and to protect you. If you ever see or hear something concerning, report it to the nurse. Never try to handle it all by yourself. Section 2 talks about the role and the responsibilities of nurse assistants. Your duties are defined by your state's scope of practice. That means that there are specific things you can and things you cannot do. Examples of that: as a CNA, your responsibilities include assisting and bathing and dressing, feeding, vital signs, and observation. Things you cannot do include giving medications or inserting tubes unless your state permits that, and you are trained and certified to do, unless you are trained and certified to do so. Staying within your scope keeps you and your residents safe. So at the nursing assistant level, you're not supposed to be given meds unless you are a med tech. And getting certified as a nurse aide does not give you privileges to give medication unless you've had additional training. That's right. Okay. So understanding what your role is, that's going to be crucially important, and all of that is a part of chapter 1. The third segment is professionalism, ethics, and legal responsibilities. Okay. Professionalism, even at the nurse assistant level, is more than wearing scrubs. It's showing respect, being dependable, and maintaining confidentiality at all times. At no circumstance should you be in Walmart discussing what you had to do for a resident at the facility where you work. That is a major, major no-no. Okay. So confidentiality is really important. Being respectful, dependable, All of that is all very, very important in your role. So you're here the team, or you're here the term OBRA. We want you to know that OBRA stands for Omnibus Budget Reconciliation Act of 1987. And here's what it does. It was created to improve the quality of life for residents in long-term care. It established training requirements and the Residents' Bill of Rights. Okay, so just because an elderly person is in a long-term care facility, they're not prisoners. They are still adults, and we still have to respect their rights and their wishes. Sometimes they don't want to get a bath that day, and guess what? You can't force them. You might can wipe around specific areas, but you can't force them to get a bath that day if they don't want to get a bath. You'll also hear the word OSHA, and we want you to know what OSHA stands for. The Occupational Safety and Health Administration, which protects workers from on-the-job hazards. Make sure you know that. Always remember, protecting residents' privacy and dignity is the law under HIPAA and under your professional ethics. The next section in Chapter 1 is residents' rights and communication. Every resident has the right to make choices about their care, to be treated with dignity, and to have their information kept private. As a nurse assistant, you are that person they are going to see most often. The way you speak, listen, and show patience will shape their entire experience while they are there at that long-term care facility. When you greet a resident, make eye contact. Use their preferred name, and always explain what you're going to do to them before you do it. Small acts of kindness build trust and comfort as a nurse assistant. In closing for Chapter 1, make sure you pay attention to all of the bold printed words, and make sure you know the definition of those words, because that's going to be very important in getting past your state certification. And also it's going to help you when you do clinicals and become employed as a nurse assistant. Pay attention to the definition of all of the highlighted bold print words. So in closing, as you move through this course, I want you to see yourself not just as a student, but as a professional caregiver in training. The residents you serve may forget your name, but they will never forget how you made them feel. Review the key terms in Chapter 1, study the residents' rights, and reflect on what professionalism means to you. In our next chapter, we're going to explore how to keep both you and your residents safe through infection prevention and good communication. Make sure that you are completing your workbook that goes along with Chapter 1. That's going to help you dissect and understand the information in Chapter 1 even better. Remember, we always check off for your workbook completion, and that counts as a test grade as well. Take it seriously. Allow the workbook to help you with retaining that information. Thank you, and that concludes Chapter 1.